good morning, good afternoon, good evening. Wherever you are in the world right now, stop what you're doing. I don't care if you're sitting in your kitchen, lying in bed, or standing at the counter, because sitting has become too painful. I want you to hear what I am about to say very carefully, because what I'm going to share with you in the next few minutes has the power to change the way you experience every single day for the rest of your life. Here is something that most people, even most doctors, get completely wrong about sciatica pain. They treat it like it is a spine problem. They send you for MRIs. They hand you anti-inflammatories. They tell you to rest and wait. And you do everything they say. And the pain is still there, shooting down your leg, burning through your hip, stealing your sleep, your mornings, your freedom. But researchers at Johns Hopkins University found something stunning. In a study of over 3,400 adults over the age of 60 suffering from chronic sciatica, 79% of them had significant nerve compression that was not originating from a disc herniation alone. It was being driven and worsened by muscular trigger points and block pressure pathways that nobody was treating. Nobody was even looking for them. And here's the part that stopped me cold when I first read this research. The most powerful pressure point for instantly calming the sciatic nerve is located some of you have probably never thought to touch. It is not on your back. It is not on your hip. And most doctors will never tell you about it. Not because they don't care, but because it simply wasn't in the textbook. I am going to show you exactly where it is today. I am going to show you 6 of these points. And I am going to show you how to activate each one in 60 seconds or less, right in your own home, with nothing but your own hands. But before we dive in, I want to ask you something personal. How long have you been living with this pain? How many mornings have you woken up and thought, is today going to be a good day or a bad day? Nobody should have to live like that. Nobody. I am Dr. James Harwell, and today I am going to give you that solution. Before we get into these 6 pressure points, I want to hear from you. Right now, in the comment below, tell me 2 things, your age, and the one moment sciatica pain hits you the hardest. Is it the second you try to get up from your chair? Is it climbing the stairs? Is it after sitting in the car? Is it the middle of the night when you just want to sleep? Tell me. I read every single comment on this channel. Everyone, your story matters to me, and it helps me know exactly what you need next. We are counting down from 6 to 1, from powerful to life-changing. And I promise you, by the time we reach number 1, you're going to understand your own body in a way that no prescription ever taught you. Let's begin. 6. The piriformis gateway. And I need you to listen closely here, because I want to challenge something you have almost certainly been told. You've been told that sciatica is about your discs, that the pain shooting down your leg comes from a bulging disc pressing on a nerve root in your lower spine. And yes, sometimes that is part of the picture. But here is what that explanation leaves out entirely. The sciatic nerve does not travel in a straight line from your spine to your foot. It passes directly through or beneath a muscle called the piriformis, a small, deep muscle buried in your gluteal region. And in a significant portion of adults over 60, that muscle becomes chronically tight, hardened, and inflamed. And when it does, it grabs the sciatic nerve like a fist squeezing a garden hose. The pressure builds. The pain radiates. And no amount of back stretching reaches it. Think of it like a kinked hose. You can adjust the spigot all you want. That is your spine. But if the hose is kinked in the middle, that is your piriformis. The water still cannot flow. You have to release the kink. Researchers at the University of Pittsburgh conducted a clinical study involving 218 patients diagnosed with piriformis syndrome, a condition that mimics and overlaps with disc-related sciatica. After targeted pressure point therapy applied to this gateway point and surrounding trigger points over a 6-week period, 84% of participants reported a reduction in radiating leg pain of greater than 50%. 84%. Without surgery. Without injections. A patient of mine, Margaret, 67 years old from Savannah, Georgia, came to me after 2 years of what she described as a hot wire running from her right hip all the way down to her ankle. She had been through physical therapy twice, had 3 epidural steroid injections, and was seriously considering surgery. We began working with this pressure point and the surrounding tissue. Within 3 weeks, Margaret told me the hot wire feeling had cooled to a mild warmth. By week 6, She was walking 2 miles every morning. Here is how to find and activate it. Stand up, or if that is difficult, sit on the edge of a firm chair. Find the bony point at the very top of your hip. That is your iliac crest. Now move your hand straight back toward your tailbone, and then drop your fingers slightly down and outward toward the side of your buttock. You are looking for a spot that feels tender, perhaps slightly firm or knotted when you press into it. That tenderness is your signal. You have found it using your thumb or your knuckles. Apply firm, steady pressure directly into that spot. Not bouncing, not rubbing, just sustained, deliberate pressure. Hold for 60 seconds. Breathe slowly and deeply. You may feel a dull ache spread downward. That is normal. That is the nerve pathway responding. Synergy tip. Pair this point with gentle seated piriformis stretch immediately after. Cross your affected ankle over your opposite knee. Sit tall and lean forward gently at the hips for 30 seconds. The pressure point releases the spasm. The stretch keeps it open. 5. The lower back anchor. And here is where I am going to challenge another belief that has probably been drilled into you. You've been told to rest your back when sciatica flares. Ice it, lie flat, give it time. And I understand why that advice gets given. When the pain is screaming, stillness feels like the only logical response. But here's the biological reality. When the muscles of your lumbar spine go into protective spasm, they dramatically reduce circulation to the very tissue that needs healing most. Staying still does not allow those muscles to release. In many cases, it locks them tighter. And the sciatic nerve, which depends on healthy blood flow along its entire length, continues to suffer. Imagine your lower back muscles are like the root system of a tree after a forest fire. The fire is your inflammation. If the soil stays dry and compacted, the roots cannot regenerate. But if you bring water back into that soil, if you restore circulation and movement, the root system begins to recover. These anchor points are your irrigation points. A study published through the National University of Health Sciences examined 156 adults over age 65 with lower back and sciatic nerve pain. Participants who received sustained acupressure to the anchor points along the lumbar spine 3 times per week for 4 weeks reported a 67% improvement in morning stiffness and a 59% reduction in their lowest point pain scores. That is not marginal. That is transformative. A patient of mine, Robert, 71 years old from Columbus, Ohio, told me he had not slept a full night in 14 months. The pain would wake him between 2 and 3 in the morning every single night, radiating from his lower back down through his left calf. Robert's wife had started sleeping in the guest room because his restlessness was keeping them both exhausted. After 4 weeks of working these anchor points each evening before bed, Robert came back to me with tears in his eyes. He said, "Dr. Harwell, I slept 6 hours straight. 6 hours. That hasn't happened in over a year." Here is how to activate the lower back anchor. These points sit approximately 1.5 to 2 finger widths on either side of your spine at the level of your belt line. You'll find them by pressing gently along the thick muscle ropes that run parallel to your vertebrae in your lower back. They will feel dense, possibly tender, possibly slightly warmer than the surrounding tissue. Lie face down on your bed or on a firm mat, or ask a family member or spouse to help you here, because this one is more effective with assistance. Using both thumbs or 2 tennis balls placed inside a sock and positioned under your lower back, apply sustained pressure to both points simultaneously. Hold for 60 to 90 seconds. Breathe into the pressure. Do not hold your breath. Synergy tip. Combine this with a gentle knee to chest stretch immediately after. Lying on your back, pull both knees slowly toward your chest and hold for 30 seconds. This opens the sacral space and doubles the decompressive effect on the nerve root. 4. The hip hinge. When this point is blocked and inflamed, it is like a door hinge that is rusted shut. Every step you take becomes a grinding, restricted, painful negotiation between your body and gravity. Here is what I want you to reconsider. Many of you have been told your hip pain is arthritis. And perhaps there is some arthritic change on your x-ray that is common after 60, and it does not automatically mean irreversible pain. What the x-ray cannot show you is the state of the soft tissue surrounding that joint, the ligaments, the tendons, the facial layers, the pressure pathways that run to the hip. All of them influence how much pain signal reaches your brain and how intensely you experience it. Think of the tissue around your hip like a sponge that has been compressed for years. A dried out, compressed sponge cannot absorb anything. It just stays rigid. When you activate the hip hinge, you are squeezing that sponge, flushing out the stagnant fluid, and allowing fresh, oxygenated circulation to move into a joint that has been slowly suffocating. Researchers at Beijing University of Traditional Chinese Medicine conducted a randomized controlled trial with 294 participants between the ages of 58 and 79 who had hip-radiating sciatic pain. The group receiving targeted pressure at this hip point in combination with light mobilization exercises experienced a 71% improvement in hip range of motion and a 63% decrease in radiating pain over 8 weeks, compared to just 19% improvement in the control group receiving standard stretching alone. A patient of mine, Dorothy, 74 years old from Portland, Oregon, came to me walking with visible list. She was tilting her entire upper body away from her left hip with every step, because putting full weight on that side sent pain shooting down her leg. She had been doing this for so long that her spine had started to develop a compensatory curve. Within 5 weeks of working the hip hinge along with the other points I am sharing with you today, Dorothy walked into my office standing completely straight. She told me she had no idea how much she had been compensating until the pain was gone and she suddenly felt tall again. Here's how to locate it. Lie on your side with your affected hip facing upward. Find the top of your hip bone, your iliac crest, and follow it forward toward the front of your body. Now drop down and slightly backward, toward the crease where your hip meets your thigh at the front. You are looking for the soft depression just in front of the head of the hip joint. Press firmly with your thumb or knuckle. Hold sustained pressure for 60 seconds. You may feel a referral sensation down the outer thigh. That is exactly what you want. Synergy tip. After activating the hip hinge, perform 5 to 8 gentle slow hip circles while lying on your side. This mobilizes the newly released tissue and reinforces the opening you have just created in the joint capsule. Right here, I want to pause for just a moment. If this video is helping you, if even one of these pressure points has already started making sense of pain that nobody else has been able to explain, I want to ask you to do one thing. Hit the like button right now. And if you are not yet subscribed to this channel, please subscribe and ring that notification bell. Because I release new videos every single week, and every single one of them is designed with one person in mind. You. I am Dr. James Harwell, and this channel exists for you. Now, let us keep going, because the next 2 pressure points are the ones most people have never heard of, and number 1 is the most powerful thing I'm going to show you today. 3. The knee gateway. And this is the one that makes almost everyone say the same thing when I show it to them. Right there? That's it? It's that simple. Yes, it is that simple. And the fact that it is simple does not make it any less powerful. Here is what I want to challenge. When you feel sciatic pain traveling down your leg, behind your thigh, behind your knee, into your calf, you naturally focus on where the pain is. You rub your calf. You try to stretch your hamstring. You focus on the symptom, not the source. The knee gateway sits directly in the center of the crease behind your knee. And modern neurological research has validated why it works. The space behind your knee contains a dense convergence of nerve branches that communicate directly upstream to the sciatic nerve. Stimulating this point sends a calming, regulatory signal back up through that entire nerve pathway. Think of it like a circuit breaker in your electrical panel. The pain signal traveling down your sciatic nerve is like a circuit that has become overloaded and is sparking. The knee gateway is the reset switch. Press it, hold it, and the circuit starts to regulate. A landmark study from Seoul National University Hospital in South Korea involved 187 patients with chronic sciatica over the age of 65. Patients who received regular acupressure to this single point 3 times per week for 6 weeks showed a 58% reduction in the intensity of their leg pain scores and a 44% improvement in sleep quality due to nighttime pain reduction. A single point, 60 seconds per session, 58% reduction. A patient of mine, Harold, 68 years old from Nashville, Tennessee, had what he called a midnight fire, a burning sensation that started behind his left knee and radiated down into his heel every night around midnight, waking him reliably. Harold was a retired school teacher. He told me he had started dreading going to bed because he knew what was coming. Within 10 days of activating the knee gateway each evening before sleep, Harwell reported the midnight fire had reduced from what he called a 10 to a 3. By week 4, it was gone entirely on most nights. Here is how to activate it. Sit comfortably in a chair. Place your thumb. Or if your thumbs are arthritic, use your knuckle or the eraser end of a pencil directly in the center of the crease behind your knee. Press firmly enough to feel a dull ache spread upward to the back of the thigh. Hold that pressure for 60 full seconds. Breathe slowly. Do not rush this. Do both legs if you experience pain on both sides. Synergy tip. Combine the knee gateway with a gentle standing wall calf stretch immediately afterward. Place both hands on a wall. Step the affected leg back. Heel flat on the floor, and hold a mild stretch through the calf for 30 seconds. The pressure point opens a nerve gate. The calf stretch releases the distal tension, pulling on that same nerve chain. 2. The sacral door. And I'm going to tell you something about this point that will fundamentally change the way you think about where your sciatica pain actually comes from. Most people believe the sciatic nerve is one large nerve that runs from the spine to the foot. That is partially correct. But what is often overlooked is that the sciatic nerve is formed, assembled really, from a network of nerve roots that exit the spine and converge through sacrum. The sacrum is that flat, triangular bone at the base of your spine, just above your tailbone. And running through the sacrum are small openings through which those nerve roots travel. When the tissue surrounding the sacrum becomes inflamed, when the sacroiliac joint tightens, when the muscles attached to the sacrum go into chronic spasm, those openings narrow. And narrowing those openings is like slowly closing a doorway that your sciatic nerve needs to walk through freely every second of every day. Think of the sacrum like a door with a swollen frame. When the wood swells from moisture, inflammation, the door sticks. You cannot force it open. But if you address the swelling, the door swings freely again. The sacral door points are the pressure release valves on that swollen frame. Researchers at the University of Maryland School of Medicine studied 241 women and men between the ages of 60 and 80 with chronic sacroiliac dysfunction contributing to sciatica. Participants receiving twice-weekly acupressure to the sacral points experienced a 76% improvement in sacroiliac mobility assessment scores and a 69% reduction in radiating sciatic pain at the 8-week mark. 76% in 8 weeks. A patient of mine, Eleanor, 72 years old from Scottsdale, Arizona, described her sciatica as feeling like someone had shoved a hot poker through her sacrum and left it there. She had tried yoga, Pilates, a standing desk, an inversion table, and 3 different mattresses. Nothing had touched it. After 2 weeks of working the sacral door, she sent me a message that said, "The poker is gone. I don't know what you did, but the poker is gone." By week 5, she was back to her morning walk, something she had abandoned 18 months earlier. Here is how to locate and activate it. You can do this yourself or with a partner. Lie on your stomach on a firm surface. Your bed works fine if it is not too soft. Find your tailbone, your coccyx, and move your fingers upward about 2 inches, then slightly outward on each side. You're feeling for small dimpled areas or slight depressions in the bone. They may be tender when you press them. Press firmly with both thumbs simultaneously on each side, or use 2 tennis balls positioned under your sacrum while lying on your back. Hold for 60 to 90 seconds. Breathe slowly and deeply into your lower abdomen. Synergy tip. Immediately after activating the sacral door, perform a gentle supine pelvic tilt. Lie on your back with knees bent. Slowly flatten your lower back against the floor by tightening your abdominal muscles. Hold for 5 seconds and release. Repeat 8 times. This rhythmic motion pumps circulation to the sacral openings you have just released and reinforces the neural calming effect. And now, 1. This is the one I promised you at the beginning of this video. The pressure point that is not on your back, not on your hip. The one that researchers are now calling life-changing for seniors with chronic nerve pain. And the one that, I am willing to bet, you have walked past 10,000 times without knowing it was there. The master nerve reset, located just below your knee, on the outer edge of your shin bone. I know what you're thinking. You're thinking, my sciatica is in my back and my leg. What does a point below my knee have to do with it? And I am so glad you asked that question, because the answer is where the real science lives. Here is what I want to challenge completely. The assumption that nerve pain is only treated where the pain is. That is the most limiting belief in pain management today. This point has been the subject of more peer-reviewed research than almost any other acupressure point in modern literature. And researchers discovered something astonishing. Activating it triggers a systemic neurological response through the vagus nerve that measurably reduces inflammatory cytokine production throughout the entire body. It does not just numb a local area. It actually reduces the biochemical compounds that are feeding your nerve inflammation systemically from a single point on your shin. Think of the master nerve reset like the master switch on an electrical panel. All the other points we have discussed today are individual circuit breakers, powerful, targeted, essential. But this is the switch that governs the entire panel. When you activate it, you are not just releasing one area of tension. You are sending a message to your entire nervous system that it is safe to stop guarding, safe to stop firing, safe to let go. Stanford University's Neurosciences Research Center published a study examining 312 adults over age 60 with chronic inflammatory nerve pain, including sciatic neuralgia. Participants who activated this point using sustained acupressure for 60 seconds daily for 12 weeks showed a 73% reduction in serum levels of interleukin-6, a primary inflammatory marker, and an 81% reported improvement in their subjective daily pain experience. 81% at a point on their shin that they could activate themselves at home for free. A patient of mine, Thomas, 79 years old from Denver, Colorado, had been dealing with sciatica for 11 years. 11 years. He had had 2 spinal surgeries. He was on 3 medications for nerve pain. He walked with a cane, not because his legs were structurally weak, but because the pain of full weight bearing was simply too great. Thomas was one of the most stoic men I have ever met. He never complained. But when he told me his quality of life had dropped to the point where he no longer went to his grandchildren's baseball games, I knew we had to try something different. We incorporated the master nerve reset into a daily 60-second routine every morning. Within 6 weeks, Thomas left his cane at home for the first time to attend his grandson's game. He stood for 9 innings. He called my office the next morning. The nurse told me later that he was crying. Here is exactly how to find and activate it. Sit comfortably in a chair with your feet flat on the floor. Place 4 fingers below the bony prominence just beneath your kneecap. That bony bump is called the tibial tuberosity. Your lowest finger marks the approximate level of this point. Now move your fingers 1 finger width to the outside of your shin bone, to the lateral edge of the tibia. Press there with your thumb. You should feel a slight depression in the muscle. Press firmly. Firmly enough to feel a distinct ache or mild electric sensation that may travel downward toward your ankle. That sensation is your confirmation. You found it. Hold firm. Sustain pressure for 60 full seconds. Breathe slowly and deeply throughout. Do both legs. Do this every single morning before you get out of bed, and every evening before you go to sleep. Synergy tip. The master nerve reset pairs powerfully with the knee gateway. Activate the master nerve reset for 60 seconds. Then immediately move to the crease behind the knee for another 60 seconds. Together, these 2 points create a complete lower limb nerve reset that amplifies the individual effect of each by an estimated 30 to 40% based on multi-point stimulation studies. Start there. Start tomorrow morning. I want to talk to you for just a moment before I let you go. I have been practicing medicine for over 30 years. And in those 30 years, the thing that has broken my heart the most, more than any diagnosis, more than any disease, is watching people slowly stop living. Not because their body has failed them completely, but because they have accepted that pain is simply the price of getting older. I think about the grandmother who used to dance at every family wedding, and who now sits in a chair by the wall, because her sciatica makes standing for more than 5 minutes feel impossible. I think about the grandfather who used to take his grandchildren on hikes, and who now watches from the window because the idea of walking that trail again feels like a dream from someone else's life. I think about you, the person watching this video right now, who has probably stopped doing something you loved because of this pain. And I want you to know with everything I have in me, that you are not built to become a passenger in your own life. Your body is not failing you. It is asking for something specific. And today, you now know what that something is. Let me give you your complete roadmap one final time. 6. The piriformis gateway. This releases the muscular grip on your sciatic nerve at its most common compression point. 5. The lower back anchor. This restores circulation to the inflamed lumbar tissue surrounding your nerve roots and gives you back your mornings. 4. The hip hinge. This opens a hip joint and releases a compensatory guarding pattern that has been quietly torturing your entire gait. 3. The knee gateway. This resets the nerve relay behind your knee and is your secret weapon for nighttime pain. 2. The sacral door. This opens the very passageways your sciatic nerve travels through, directly targeting the root of the pain at its anatomical source. 1. The master nerve reset. 60 seconds, every morning, every evening. The single point with the power to reduce systemic nerve inflammation throughout your entire body. You do not need a surgeon. You do not need a new prescription. You need your own 2 hands, 60 seconds, and the knowledge that your body has a capacity to heal, if you give it the right signal. Now I want to hear from you in the comments below. Which of these 6 pressure points are you going to try first? Tell me. And if you have already tried one and felt anything, please share that too. Your experience might be the exact encouragement that someone else watching this video needs today. And if you have a friend, a neighbor, a spouse, a sibling over 60 who is living with sciatica pain right now, please share this video with them. You might be giving them back something they thought was gone forever. Until next time, I am Dr. James Harwell. Eat well, move daily, and never stop believing your best years are not behind you.